I would like to say that it's such a great honor to have Professor Huang to give us individual interview. He's so famous. I believe many of you heard about his names. He came from China, but one of the world top professor and experts. This time it's presented by the TCM Zone. This webinar and Sebula, it's such a great honor to have him here. And also we can have lots of communication. Before we started, we are going to invite the CEO of Dr. Wen to introduce our honored guest. 文总该你了。
文老师，您麻烦可以开始介绍一下黄黄教授。好，大家好，我叫文吉普。
Good evening. My name is Dr. Wen Jipu, the CEO of
我今天很荣幸
TCM
有这样机会介绍
It's my honor
黄黄教授。
to introduce Professor
黄黄
Huang.
老师呢是北京
Professor Huang
也是南京中医大学
is a
国际
professor
经方
from
学院的院长、教授、博
Nanjing
士生导
TCM
师。
University
他从
and
事中医
also the
48年，
president of the
经
classical
方呢
formula
是经典方的职业
professor
生，主要是指
and
记载的
mentor
伤寒论、
for
金匮要论、
doctoral
药
degree
历、古代
students.
经验方，
He's been working
经
in
过数
TCM
千年的
48
临床
years,
检验，这些配
and
方
he
成为
found
中药
that
临
those
床的
formula
规范方、
has
基
been
础方，
tested
其
more
中不
than
仅
1,000
沉淀
years.
了我们中华
So
民
they
族使用
found
天
out
然
they
药
have
物的经验结晶，
so much
也蕴含
sediment
着
and
中医
essence
中
of
国古
Chinese
代医学
medicine
认识人体、
and
控
the
制疾病
Asian
思想方法。
Chinese medicine to
历史的经验证明，经方是
control.
国际中医的最佳途径。
So from the
而其中
historical
方正的学
experience
习
that
更是学习
classical
经方的
formula
重
is
点。
the most important
黄黄
thing
教
to
授的
help
经方教
at the
学
same
没有
time,
空泛的理
and
论
his
解释，
teaching not
专注于经方的
empty
方正描
theory,
述，
but it focused
语
on
言呢
the
质朴
classical
直白，
formula,
经
the
扣临床，
structure.
重在
The
讲清
language
是
is
什么，
very
而不去纠
simple,
结为什么。
plain, but the
方正
close
相应
contact with
是
clinical
黄黄经
practice
方教学的中心思想。
focus on what is that,
这
but
是一
not
种纯粹的
to
东方思维方式。
lingering with
现在
wine.
的中医教
The
育
whole
教科书有很大的
central idea of
多
the
年来，
formula is
黄黄教授致力于经方医
formula
学的
and
推广和普
syndrome
及工
combined
作。
together.
除在
So
中国国
for
内
the
各地
past
讲
many
习外，
years, he's been
还
focused
受
on
邀到美
classical
国、
formulas
德国、
expansion
英
and the
国、
general province. So
法
his
国、
teaching in United States,
瑞士、
German,
新加
England,
坡、
France,
马来西亚、
Switzerland, Singapore,
新西兰
Malaysia,
等许多
New
国家
Zealand,
受
many,
到
many of
听
those
众的
countries.
热烈欢迎，
He was such a
被誉为
deeply
国际经方
welcomed.
的点火者。
He'd be honored as
他的经方课
the
程
eaglighter,
反应
the
听得
fire for the
用得上
classical,
上
the
手快。
international classical
黄黄
heat.
经方课程
And
成为
his
许多针灸
class,
师
we can
记忆式的短
hear,
期
we
内
can
掌握
use it,
中医
and
药物
very
疗法
quick.
的入门课
So his class
谢谢大家。
is becoming the fundamental entrance class. Thank you very much, Mr. Wen. Let's have Professor Huang to start our presentation. We know his time, Professor Huang's time is very precious. So in order to present his information and the essence, we prepared a few questions. Let's see how Professor Huang can answer our questions, so we can have a better communication with Mr. Professor Huang. Let's see the three questions. First one is, we know you're the world-renowned classical experts, so we want to ask you questions based on so many years' experience. For you, what is the biggest feeling about the classical formula? What is the most important part? I'm so glad to be here about this interview. The first question is a great question. To learn classical formula and what's my best improvement? I think my best improvement is about the clinical effects. the clinical effects improved so much. Since 1973, I started Chinese medicine about 48 years now. So I study and I do a lot of research. My purpose is to improve the clinical effects, to solve the patient problem. So my starting point is clinical results, the end point also clinical results. After studying classical formula, my effects got a great improvement. Why? Because mainly is the following a few points. The first one, it helped me master Zhang Zongjing, the ancient master doctors. The clinical thought is actually very simple. It's mainly because you gotta put the formula and the syndrome together. As you know, classical formula, they focus on the syndrome, and the syndrome and herb combined together. There are two keys. The target is the syndrome, but so the two keys, the herbs and formula has to match to each other. So in ancient time, this is actually very simple. It's very simple thought. No other complicated differentiation thought. It's just one step towards the solution. Using our Helan province people say, 中 is the 中 means you got it, target. So when I was in there, they said, first of all, we need to differentiate yin and yang, differentiate qi and blood, differentiate meridians and zangfu, and also to check out if you have one cold dampness. It's very complicated. So by the end, this looks like a pretty complicated. It's hard to differentiate. But classical formula just focus on syndrome and formula. 桂枝汤 focus on 桂枝汤 syndrome. When you get the right point, you get it and it's safe. So that's the first meaning I would like to share with you. The second, I found that the ancient, so when they use the classic formulas, it's focused on that person. It's individualized. So a lot of time you can see it or you can touch it, like a 黄芪桂枝五物. Focus on 真容 person, 真容 people. What does it mean? It means because this person's social status is high, and also he doesn't do much labor work. He lazy, a lot of leisure times. So he's a little overfat. He's pale, sweaty, and he's just having great life and focus on fine food. So those people will have those tingling numbness of the extremity. So they use 黄芪五物汤. Some other, you use a hand to touch, like a 大柴胡汤. When you touch it, when there's discomfort under the heart and the zangfu organ exploded and extended, then in this case, we will use 大柴胡汤. So it tells us to use this kind of classic formula. You really need to look at this person. Inspection is very important, or your palpation, that's the touch. These two are very important. So we always focus on just one disease or syndromes. Well, classic formula is a little different. The third one I found is not just for people. It also can treat a specific disease. For the person is for individual change. So you can use the herb precision. But the second one is the classical formula is to focus on the disease. The disease is like wasting syndromes and the cold hernia. These are all disease, or wind stroke disease. So, 伤寒病, the 伤寒论 focus on those disease. 金匮要理 focus on disease. So 伤寒论 for people, 金匮要理 for disease. So if you have a discomfort under the heart, use 半夏泻心汤. So a lot of times focus on the disease. So when we study 伤寒论 and 金匮要理, the golden chamber, we understand that Asian doctor, how they understand disease and treat the disease. What are the main route of thought? So in fact, in the preface, it's to Zhang Zhongning says, when you read my book, it's to help you how to think in the right way. So these are my three major rewards.
那么我们的第二个问题是，您认为学习经典著作、研究经典方剂，这些对于现在的中医
What do you think about the significance for the clinical practice nowadays? Study classic formula. What are the significance for the clinical practitioner to start classical formula? So when we graduate, so we're getting excited, so we'll start to see patients. So what are your suggestions? So we may not have time, or we're not interested about study that classic formula. It's very important and very necessary, because classic formula is not necessarily high, big, and superior. It actually is a foundation. What does it mean? It means in foundation, this is the standards of Chinese medicine. So you got to follow the standards. If you understand it, then you can make a variation, make changes. So with standard, then you can have the form and build. Then you have a standard, then you can change. It's hard to learn Chinese medicine. It's actually because you don't know the standards, or your mentor did not teach you the proper standards. So from the beginning, you already you're confused. Then how you can move forward later? So you cannot really raise your level. So to study Chinese medicine, most important is to learn the standard. Of course, yeah, Chinese medicine will always have standard. Without standard, we cannot be lasting over 3,000 years. So what's the standard of open writing a formula? It's classic formula. Classic formula are the standard. If you do acupuncture, it's many in the Ningshu book, the spiritual axis. So if you want to prescribe herbal formula, you have to learn classic formula. Because it's not just about how many herbs inside, what herb inside. And most important is what is this formula suitable for what patient, what kind of patients. With this standard, then you can move forward much better. Then you can take care of patient much better. Even in the beginning, you may learn just a little bit at the beginning, but the classical formula is over 260. But the most common one owns about a few tens, but maybe about 40. So those are the very important. Once you master about 40 formulas, you can see patients. If you master 10 formula, you will be a very high level practitioner. So it's extremely important for us to study classic formula. So don't be afraid, and it's not too difficult. This is just a foundation. This is the standardized formula, very important. It's absolutely necessary, fundamental skill and the series. Thank you, Professor Huang. That's a fantastic explanation. That's a great inspiration. And the third question is going to be, when you study those classic formula for so many years, that's to you, what area you think is the most difficult area? What area is the most difficult area? So when we study classical formula, well, these are great questions. Yeah, sometimes we do feel it's very difficult because we start with a different point. So everyone has a little different situation. To me, my experience is when I study Chinese medicine, I started with the common formula, particularly is more later formula, like worm disease formulas. Family is Jin Jiangsu, so we do have a lot of Wenbing theory school. So we were in the middle of the Cultural Revolution. There are a lot of big movement on using Chinese herbs. So it has political movement right there. So I was learning a lot about herbs. The second one is the combined Eastern medicine and Western medicine come together. So you use a little bit Western medication and herbal together. So that's the second, the social environment at that time. So we did not start with the classical formula. Then we found out, wow, classical formula really good. So about 10 years period, after 10-year period, why we didn't find it at early time, there are a couple of reasons. As many, we need to read more books. Or second, because we didn't think about it. Or the third one is because my brain is full of a lot of stuff. When your brain has too much other stuff, and then you get a lot of the school theories, and so it's occupying my brain. So like I'm wearing colorful glasses that interfere with my understanding. So that's the reason a lot of graduate students nowadays, they have quite a bit difficulties because they already preoccupied. Or in the brain, you think, oh, when you see the patient, you say, oh, where's the yin deficiency, where's the yang deficiency, spleen deficiency, and kidney deficiency. So you always think about this kind of question. So, or okay, now Huang Qin, oh, will that be so bitter or too much for the stomach? Or let's use Mai Dong or Sandy, or will that cause too much greasy and sluggish digestion? So we're always interfered by this kind of theories. And then the next, we'll think about the classical formula. That's only a few herbs can you treat disease, so we don't have confidence. So in the brain, we don't have the classical formula way of thinking. So to this point, then you'll be very difficult. Now, of course, you cannot understand that. You cannot go into the books. So the most difficult part is you need to get rid of those old thought and frames in your brain. Get rid of those extra thoughts. Clean them up. Okay, you need to uninstall those software. Okay, so in this way, that means it's a brainwash to clean up, and then you learn the classical formula. So I found out a lot of those hobbies after, but they never learn Chinese medicine. But when they start learning classical formula, they're pretty quick. Or Western medicine doctor, they can learn classical formula pretty quick. Why? Because the brain are pretty clean. So they just say, oh, what is it? I'll use this formula. That's why he's so much faster. I want to give you an example. One of the Japanese doctor, Dazong Jinjie, name is Otsuka. He is titled the genius of Japanese Han formula because he is very good at using Asian classical formula to treat the modern disease. He found out it's working very good, like a 大柴胡汤 to treat hypertension. And it works great. So we always use 大柴胡汤 to treat liver wind or liver yang rising. We need to use 羚羊角, goten, but this doctor, he thinking differently. He used Master Zhang Zongjing's thought. He palpated the body, the tummy. The tummy is very hard and with tender spots. For this case, he is going to use 大柴胡汤 to treat the hypertension. It's very simple. And of course, also not treating the disease, also treat that person. That's the reason it works so well. So from this example, that you gotta understand that sometimes you gotta really using the form when you learn the formula, you gotta get rid of those extra thought and the frame in the brain. You gotta remove those software, and then you can get a clean body and clean brain.
谢谢黄教授，今天这个黄教授最后总结的这个非常好，返璞归真啊，要刨除一切这个杂念，要反而归于一。
Thank you, Master Huang. That's fantastic. What you mentioned about those several areas you need to clean up the brain. And thank you so much again for your precious times. So I hope all of the attendee today enjoy and thank you, Dr. Yo, for translation. And then we're looking forward to see Master Huang. Thank you very much. Thank you very much.